I actually wanted to jump into that. So if you don't mind, can we talk shop a little bit about like sports?
Yeah,
I
for
know
sure.
like you're not on call for this podcast, but I watched a video by Jeremy High Roller. I don't know if you watch his videos about basketball
Yeah,
analysis, but
they're
one of his
awesome. I love them.
videos,
Yeah.
yeah, yeah. And there was another guy named Derek from More Place, More Dates, and they were looking at PEDs or
Yep.
performance enhancing. And you were talking about nutrition and growth. I was very intrigued by like your comments about LeBron not getting back to 100% and like you thought he could, but there's been a lot of controversy around LeBron where he um, is accused of taking growth hormone, helping him recover faster, angiogenesis, vascularity in the tendons to like help him recover faster. He spends $1 million on his rehab. So for me, it's been a point of contention because should physicians enable that type of recovery? Because obviously we have the knowledge to help teams recover, and you as a PM&R sports medicine kind of expert or soon to be expert um, will kind of have that deep knowledge into, hey, do we give GH or do we increase VEGF like in the body to like perform angiogenesis or blood growth towards the tendons to help them repair. So again, this is a long-winded question, but what role do you see physicians playing in that technology, biotechnology increase in sports?
That's a really good question, and something that's definitely going to have a big role in the field in the future. And in a sense, we're almost kind of going that way already with some of these regenerative medicine procedures, as we call them, with stem cell therapies and PRP. That's what we're trying to do. We're trying to inject things, put things in the body to help encourage growth, encourage healing. And so it is definitely closer to that, improving recovery than we were, say, 20, 30 years ago. It wouldn't surprise me, to be honest, if at some point down the road the sports have evolved and the science has changed in such a way that maybe we are using different supplements for injury healing after somebody had an ACL tear. I can't see ever using them for performance. I mean, I think that's something that will always rightfully be off the table. But I think there is, you're right. It's tough because our job as physicians is to get people healed, to get people back healthier. And if there's something we can give people to help them heal better and healthier, why wouldn't we do that? I think the hard part is there's a very, very fine line between when you consider something unfairly enhancing and
Mm-hmm.
something that's sort of accepted standard medical practice. And right now, even outside of the sports community, we're not giving people growth hormone for when they have injuries. We're not giving people anabolic steroids. And so that's not even something that is outside of the sports community. So before any of that ever came into the sports community, we'd have to be doing it outside of the sports community. And who knows if it'll happen. I think the research with the stem cell procedures and the PRP and these orthobiologic medicines, we call them, is really promising and pretty cool in and of itself. And so I think that alone is going to give us a whole other kind of perspective on how we treat injuries with, doing PRP or stem cell injections after somebody's had an ACL tear to try to facilitate post-surgical healing. I think we're going to someday have injections or procedures to help with stimulating cartilage growth in people who have arthritis. And so that's going to be probably what's going to happen before we ever see any, growth hormone, stuff like that come into play. But it is an interesting question because, yeah, we're there to help people. And I know plenty of sports docs who take care of patients who take anabolic steroids, just regular average people who have chosen to do that. And it's not like we turn them away, and say we're not going to help them if they do get hurt. So we have to be aware of it all. But it's definitely something that will be interesting to see how it changes in the sports world in the future.
I wanted to kind of bring you back to that point where you were like, there's a fine line between healing and performance related steroids or performance related drugs, let's say. How do you define that line? And is there a red line or is it more like blurry in terms of what is going to happen? And is that going to become more blurry, I feel, with more of these treatments that you're mentioning?
I think it might become a little bit more blurry with some of these treatments we're mentioning. I'm far from super knowledgeable about all
Right.
the mechanisms of some of these things and when and what people are using them for. It's nice that we know for sure what the line is in terms of what like the U.S. Drug is, the USADA, like WADA, and all those people say we can and
Mhm.
can't use. And I think we just say, well, okay, it's there. We're not going to use it or do anything with it. The other thing too, I mean, some of those can be harmful. Some of these injections, these anabolics, these growth hormones can be pretty darn harmful for people if not used the right way. And so I think there's also that component of risk with some of this stuff. Um, but I don't know how you exactly would define that line. It's easy for us because we can say, well, these things are banned. And so we just don't even
Yeah.
talk about it. And I think that down the road, we'll see, when you give somebody platelet rich plasma or like stem cell ish procedures, you're taking something from their body and putting it back in their body. It's not like you're giving them a drug or giving
Right.
them something that was synthetically, created in a lab, which I think is a little bit of a differentiating factor. But yeah, it is an interesting thing. I don't know
Yeah.
what sports docs, I don't know what we'll be doing. Ask me in 10, 20 years
Sure.
when we're putting stem cells in
Yeah.
everybody's knees for their arthritis.